The rationale of the study is based on the question that endotracheal intubation is still discussed to take care of patients with cardiac arrest out of the hospital. And especially since in the last years, some studies issued from registries have demonstrated that bag mask ventilation, that is an easier way to take this patient in charge, could have better results in terms of survival with good clinical and especially good neurological outcomes for these patients. And the results of these observational studies were so good that, we wanted to know exactly if we can change our practice and the way to take in charge our patients and go to the bag mask ventilation rather than the endotracheal intubation. The study design is a randomized clinical trial with non-inferiority hypothesis, and we calculate that a sample size of 1,000 patients per group will allow us 80% power to demonstrate non-inferiority with a non-inferiority margin of 1%. And the primary outcome of the study is survival at 28 days with good neurological outcome. And the secondary outcomes included return to spontaneous circulation and survival at admission and adverse effects. Well, first of all, we have to consider that our hypothesis were based on the idea that the bag mask ventilation will be better than endotracheal intubation for main outcomes. Indeed, our main results was not this one, since we have found more or less exactly the same rate of survival with good neurological outcomes in the two groups, 4.2% in the bag mask ventilation and 4.3% in the endotracheal intubation group. So the other results as there are the return of spontaneous circulation was higher, significantly higher in the endotracheal intubation group, that is 38.9%, than in the bag mask ventilation group, that was for 34.2%. The survival at hospital admission also has shown a trend for a better survival in the intubation group. What was also very interesting is that in this trial we have collected very precisely the technical failures in the two groups, and the failure in the bag mask ventilation was higher at 6.3% than in the intubation group. That was only at 2.5%. And the aspiration or regurgitation of gastric content was also very significantly higher in the bag mask ventilation group than in the intubation group. Before the study, based on the results of registries and observational studies, we were very much interested to change our practice by going from the intubation technique to the bag mask ventilation technique. After the study, we have to say that we do not see anymore the same interest to change the technique. And we have seen that maybe the rate of failure of adverse events with the bag mask ventilation technique is not so low than it can be considered before the study.